Hello everyone and welcome to Rad Chat, founded by me, Jo McNamara.
And me, I'm Julka-Anderson. RadChat is a forward-thinking global knowledge hub where healthcare professionals can advance their expertise in therapeutic radiography and oncology. Unlike traditional academic resources, we blend real-world experience, expert insights, best practice and patient perspectives.
We make advanced knowledge engaging and accessible, supporting continuous learning and professional development without compromising patient care or your personal time, by providing insights into both technical skills and career development, helping you to progress confidently in your field and shape your professional future.
Just to let you know, our episodes may contain sensitive and difficult topics that you might find distressing or triggering. Please consider checking out another episode.
So this is episode 207, which is part of the Living With and Beyond Cancer series, where we're going to be hearing from our guest, Emily Spillman, and her role as a physical activity lead at Penny Brohn UK. So hi Emily, welcome to Rad Chat.
Hi everyone, thank you so much for having me. This is very, very exciting.
An absolute pleasure. We've been very excited to have you on, and it from a personal perspective, talking about prehab and rehab, I'm very excited. So Emily, for anyone listening who doesn't know you or hasn't heard of you before, can you give us a bit of a kind of introduction to yourself and a little bit about your career today?
Yeah, for anyone that does know me, they will know that I wear many hats and spin many plates. But I suppose my current roles at the moment, I am the physical activity lead at Penny Brohn UK, which is a cancer charity, which we'll talk a bit more about in a moment. And then alongside that, I'm a nurse as well as a personal trainer. So that's my kind of hybrid roles, I would say. They're kind of almost like two things together now. And when I qualified, which was 2012, I actually started my career at the Bristol Haematology and Oncology Centre as a chemotherapy nurse, and worked there for a few years, sort of working my way up the ranks and working within haematology and oncology, working in day units as well, which gave me quite a breadth. And then I had my first child, and then I thought, I'll have a challenge and go to A&E. Soon realised that, that's a very different ball game to cancer nursing. So swiftly moved into the community and did, community nursing, which I loved, and going out into people's homes, doing end of life care as well, which I really was a huge passion of mine, as well as like wound healing and stuff like that. And it was then that I really started to, I suppose, put the pieces together a little bit in terms of the work that we were doing as nurses, and often very task orientated. And you probably see this in the NHS a bit, but not necessarily everyone putting all the pieces together and working together to support someone. And that is across kind of, again, wound healing as well. I remember, supporting someone, and we were just all fighting over what wound dressing to put on this person, and not necessarily all of the other stuff that's going to help that person heal. And again, even in diabetes care, and I was starting to sort of use a lot of my little bit of knowledge that I was gaining through my training as a personal trainer, because I sort of did that alongside my community nursing. And I thought, well, if I can use that knowledge and see if I can support people in a more holistic way, and that kind of then enabled me to start doing some community exercise classes with an older ladies group in my local community centre. And then good old COVID happened 2 weeks later. So I was really back into like fighting fires in the NHS and sort of getting through the pandemic. But ultimately, after that happened, I was introduced to a physio at GenesisCare, which is a private cancer company, or delivering radiotherapy and chemotherapy, and they provide a 12-week exercise program. And I thought, actually, that brings my two worlds together really nicely. So I took the role there as their personal trainer, and the lovely Sarah there, who I miss dearly, was just amazing at allowing me to really shape the service. And we sort of launched our online program there, and it was really like my baby at the time. And then it was really successful, and we were able to then reach more people who ordinarily would come for their radiotherapy but then weren't able to then get to the centre to do the exercise program. So that was really great. And then I unexpectedly, and me and my husband were a bit irresponsible and had a second child. That wasn't in the plan. Actually, during that time, it was great, would not change it for the world. But I was then GenesisCare have a partnership with Penny Brohn UK anyway, and I knew about the charity and supported it and loved everything that it did. But they asked me to be the physical activity lead because it was a role that had been empty for a little while, and I've been there for nearly 2 years. So yeah, that is essentially me in terms of career. Well, I say that I was doing a bit of part-time work as well in the bladder and bowel service, which then, as again, that many hats, many spinning of plates. But actually, during the pandemic and after the pandemic, and I was working part-time at GenesisCare, I started working within the bladder and bowel service, and that opened my eyes fully just to kind of what people were dealing with. And I just fell in love with it, and it again really supported a lot of the work that I was doing with people who were struggling with symptoms after their cancer treatment. And I got to learn about doing pelvic floor assessments, so doing internals, and that just sent me down a real rabbit hole of learning about women's health particularly, and that is a huge passion of mine and something that I now do in my own business and running that alongside all the other plates and hats that I do. And really, I think for me as a personal trainer now, I am really passionate about making it accessible, but also obviously exploring the benefits, which we'll talk about in a second, but in a really accessible, down-to-earth way, which I think people will start to notice as we go through this podcast.
So you're a busy lady, Emily.
I am.
I think one thing you have highlighted, though, really succinctly, actually, is the fact that having a portfolio career allows you to look at things not just in that kind of two-dimensional viewpoint and almost with your blinkers on. I know Numan and I have said this loads, but, you know, the work we do with Radchat and stuff really allows you to get that holistic approach to supporting people going through cancer because of the fact you're learning lots in each of these different roles, but you do then bring that knowledge into other things that you would never have ordinarily brought them into. What's been the most transformational thing, do you think, from your learning in your different roles that you think has had the biggest impact on patients?
I think for me, it is really seeing the barriers that are really impacting people's ability to exercise. And I think particularly through my education in pelvic health, about that mind-body connection and not being able to separate those two, and how that can, I suppose, impact our physical self when, you know, our mental health is affected, but also in terms of our nervous system and how that impacts our ability to make decisions and to, you know, ideally we want to be able to do health promoting activities, but for a lot of us, like, we are often in a bit of a fight or flight. We don't have the education or the agency to do all the things that often, I think, for a lot of healthcare professionals, we just think, okay, we'll just tell that person to exercise more, but not really understanding the kind of social determinants, but equally just the everyday barriers that I think a lot of us are facing. And we only have to look at the news at the moment, and it is a very hectic world that we are living in at the moment. And I think through my work in my own practice, in my personal training, but also speaking to women particularly, I do work with men occasionally, but they are exhausted. You know, all of us are really spinning a lot of hats and plates. I don't think I am an exceptional, you know, I'm not out of the exception here. And I think, you know, when we deliver certain messaging around it, exercise in particular, and you've got to think about the fitness industry as a whole, diet culture, you know, the
not forget high rocks. I feel like you can't talk about exercise and not talk about high rocks at the moment.
Absolutely, but it is super high intense, and for the majority of people it's not an accessible form of exercise, but it's, you know, can be an amazing form of exercise and community, but it's just for different people. But I think sometimes we glorify a type of exercise, and then it just makes everyone else feel like, oh, I'm not doing enough, and I think we're all feeling like we're failing at something. And I think for me, acknowledging people's barriers to exercise, I think, is a really important thing that for us as healthcare professionals, we need to understand. And I remember recently having some medical students from Bristol University in, and we were talking, and I got them to sort of, between us, like, note down, what barriers do you face with exercise? And they did have quite a few. You know, time's a huge factor. Finding spaces that people feel that they belong and they can feel, you know, comfortable in their bodies are quite rare for a lot of people. And money as well. And then you apply, like, having a cancer diagnosis. and all of the treatment that's coming up. But even some of the language as well that we often say around exercise can be like a massive shut the door on exercise for a lot of people. And then they're just too scared to then to do that, to do any form of movement, to be quite honest. You know, I've worked with quite a few people now that I think often they're just like, oh, I've just been told not to do something, or it might be that I can't do any repetitive movement, or I can't, you know, I think there's so many can'ts, and we don't then follow it up with what can that person do. And that can then be like a huge facilitator for exercise, because one, it's come from a healthcare professional, or it's come from a professional, which is a massive thumbs up. But at the same time, we can use our language to be protective. I think ultimately we want to do no harm, and I completely get that. But I think someone being sedentary and not doing anything at all is more harmful for that person than potentially the risk of exercise to the individual, which is very low for the majority of people. But yeah, it's definitely made me more holistic, having different hats, and thinking about those different elements of someone's life. And I think being compassionate to oneself when we are navigating changes in our activity or changes to our emotion, you know, how we're feeling, the fear of treatment, the fear of hurting ourselves, you know. So I get people who are super active and then stop because they're like, oh my God, I just don't want to hurt myself. And they can then often then carry that on through their treatment and beyond. So my job is very much around taking a step back and acknowledging and validating people's barriers, but then giving them some solutions to support them to even just do a little bit of movement. I think is a huge bonus, I think, for a lot of the community that we're supporting within the NHS and the private sector and charity sector as well.
I was really naive about some of the challenges and barriers, because quite often when I speak to people about doing exercise, I always thought, well, cost and time are going to be the ones that come up really frequently. But actually, a lot of people said, well, I don't own any trainers. I have no kind of clothes that would be suitable for me to go and participate in a sport, and I had never ever thought someone wouldn't have a pair of trainers. But it's that kind of insightfulness that I think is so important, that you do ask what those barriers are so that you can help find solutions, rather than just have this, you know, sense of, well, anyone can do exercise. You know, yes, they can, but sometimes there are real challenges that stop people from doing that.
Yeah, and I would say for those people who, you know, I wear quite a lot of kit from Tesco. I literally have stuff from, you know, Go Outdoors. Like, it doesn't have to be Sweaty Betty and Lululemon. Sorry, there are other brands available. But it can be. I think, you know, social media and everything else can make it a little bit of an aesthetic. Ultimately, I've worked out in my pajamas and barefoot as well. Obviously, going out and doing a sport, you know, I think is very different. You know, having appropriate footwear is important. But yeah, but for a lot of people that can be reality. But I think as long as they're sturdy shoes, I don't think we need to get too hung up on, you know, having the latest, you know, brand of trainer. But as long as they're good sturdy shoes that can help you get out for a walk, I think is a good form of exercise too. So yeah, but I think it's our perception of what exercising should look like, and it should look a certain brand or a certain way. And actually, you know, movement can be hiking up a hill with a baggy t-shirt and some, you know, some trousers and some sturdy shoes, or a pair of Wellington boots. And yeah, so again, with, I suppose, yeah, the equipment required, there is definitely lots of things that we can do that doesn't require equipment or big memberships or, you know, big commitment, I think, as well, to certain types of exercise.
Emily, just thinking back to your education, kind of doing nursing, how's your perception of exercise, physical activity changed since then? And did you have any of that in your education?
Yeah, it's changed a lot. I remember being in just the lunch break room on most wards, and our perception of exercise was that it had to be hard or go home. It had to, like, we had to do it unfed. You know, our perception of diet culture was rife within the nursing rooms, and we are not educated very well on, I think, the realities of the majority of people in society when it comes to our perceptions of exercise and nutrition. I would say I had quite a poor relationship with exercise and nutrition prior to training, and then educating myself better in particularly in the women's health sphere. It was all about exercising for weight loss, never about exercising just for general well-being. Yes, the byproduct of exercising made me feel better, but that was not my goal. My goal was to be thinner, essentially. And so my relationship with exercise has changed immensely through, I think, just understanding the benefits aside from weight loss, in terms of supporting our mental health, but ultimately like our immune system. And, I speak about this a lot at Penny Brohn in terms of just by contracting our muscles, that can produce immune cells that can reduce inflammation, and it's an anti-inflammatory properties that can really help create like an anti-cancer environment in our bodies, essentially, and to mobilize our immune system to be more effective. And that's the same for any inflammatory disease. Exercise can be really helpful for managing joint pain, osteoarthritis, but often our societal expectations of exercise is that we have to be gentle, we have to rest, and we have to, not injure ourselves when we have these conditions, when ultimately the movement and physical activity and structured exercise all have its place in helping us to reduce the inflammation and then that effect that has on our bodies. And because of that anti-inflammatory effect, it can really help with things like fatigue. We know that fatigue is a huge, probably the number one side effect of treatment with cancer, and it is a really hard one to navigate because a lot of the time movement does not feel like the first thing to do when you're feeling fatigued, and it's definitely dose. The amount of exercise is important too, and we know that by moderate intensity exercise sort of yields the best sort of effects when it comes to fatigue. But that's not saying that lower intensity exercise isn't valid, because we know that things like yoga, tai chi, Pilates, they kind of have like a really nice psychological effect as well, which again, psychological stress can increase inflammation. So if we could reduce psychological stress, that can also help with those sort of anti-inflammatory properties too. So that's why I would say, yeah, it's definitely evolved to being a bit more, what is movement going to give me that is aside from the aesthetics? And I think that's definitely improved my body image in terms of like my body is not my business card when it comes to being a PT. So, but at the same time, I use movement in a definitely more positive way, and it doesn't take up all of my, what's the word I'm looking for? Like, I'm not preoccupied with like, have I done enough movement? Have I done enough steps? Have I done my 150 minutes of physical activity? And
have you videoed it for Instagram as well?
Have I? Yeah, and that's I'm friends with a lot of PTs who are on Instagram, and it is a real, like, none of us really like doing it, and I've kind of stopped now. I did do it in my pajamas, so there is me exercising in my pajamas on the internet, so I am practicing what I preach.
I think that's a bit of a worry for maybe some of the younger generations of healthcare professionals, but also our patients coming through, where the perception of your body, an app can make you look completely different. There's obviously different types of injections now, almost like a quick way to lose weight, but actually the healthy side, as you talked about, I don't know, it's a bit of a minefield anyway when it comes to cancer and all the different interactions with drugs and chemotherapy, etc. But it is a bit of a worry, I think, for me, just what the next few decades is going to show around exercise and physical activity.
I get where you're going, Naman, but I also think it's always been around, because I've been supporting women in their 80s, sometimes dying, who are just like, I've never looked so thin. And like, it's just, I feel like there is just this culture that we have of like, that's the most important thing. And I think it's just different. I think it's just changed and evolved. It's always been there, but I think it's changed and evolved as we've through the generations. And yeah, I think the aesthetic of exercise is definitely on my feed, and it is very difficult for me as a PT who wears size 14, 16 fitness clothes to have that representation. And I can still, we know that in terms of our health is not something that we can see, and you only have to, and I see this so much in the cancer community as well, because I feel so sorry for people, because the first thing people go, oh, you look great and you've lost weight because of your cancer treatment. And it's like, it's like, when are we going to, we need to get better at understanding that health is more than a look, if that makes sense. And the benefits of exercise are something that we don't always see. We don't get that instant gratification, but we know just from like one bout of exercise, we get that anti-inflammatory effect essentially, and the benefit that brings. So I always say like the magic is happening on the inside. I know it's not showing you or yielding you the kind of stuff that we sort of see, those outcome measures that we see on the outside, and I think in terms of confidence, I've seen from my work, I have a gym here at my home and I work with like 3 women at a time. And I remember like one lady really struggling with a lot of fatigue and, like migraines, like hormonal because of like her treatment. And she was like, I really need to do more than just like 1 a week. And I said, yeah, but what are you doing right now? She's like, nothing. I was like, okay, let's just do 1 a week. Let's just get 1 strength session in a week and do that with me. I can give you some confidence and, some support with that. And she's been doing that consistently for over a year now. So, and now she's like, oh yeah, I can start adding some more things. And she's starting to feel better. She's managing some of those side effects a bit better. But the sad thing is that, going to her GP, and I'm not anti-GPs at all, so any GPs listening to this, but just maybe hear this. But, she went and the GP, and she said, oh, I've been doing this like consistently. This was about 6 months in. And, and she's like, what are you doing? And, she said, oh, I've been going once a week and it's really great. She said, oh, yeah, but we ideally need to get to like 2 times a week. And rather than praising her for being consistent with that, it was just like straight into like, you need to be doing 2 times a week. And I understand that the guidelines are there, but they are just guidelines. And we have to meet the person that we've got in that clinic where they're at, because to her, that completely shattered like all of the hard work that she's done in terms of having a consistent something for her that she had never done her whole life. Just because someone's, had cancer, or have a long-term health condition, they might have had no activity prior to that health condition. It's only now that they have their health condition that they're thinking about, integrating things. But for them, they might have families, they've, got juggling lots of plates. And so a consistent once a week, that's a well-structured exercise routine, can be really okay. So I think we've got this perfectionist mentality, and as a recovering perfectionist, I understand, but it's we just got to kind of let go of the ideal, because we've got lots of research, and I will actually share with you the ACSM, but they basically put out all of the different like health related outcomes for cancer, and like how much exercise and what types of exercise, so whether that's like aerobic exercise, so like cardiovascular exercise, or resistance only, or a combination of the two, and then just giving like how many sets and reps is like supportive of like cancer related fatigue. And it's just a really helpful guide as well for things like bone health as well, which I know is another big thing for a lot of people, and when they're navigating, particularly in recovery after their treatment, but also things for like lymphedema as well, and how supportive resistance training is for lymphedema. So all these concerns that often people have, I think this is a nice thing, so I'll share that with you guys to share with your audience. It's just it's visual as well. I'm a visual learner, so I like things to be nice and visual and easy.
You talked about Penny Brohn. Do you want to tell us a bit more about that, please?
Yeah, so Penny Brohn is a cancer charity based in Pill in Bristol. They have an amazing, lovely, stately home there, which they've put extensions on over the years as well. And we provide holistic cancer support, looking at the kind of toolbox of support that we can give people navigating cancer as a way to support their treatment. Because Penny Brohn, who founded the charity, always saw that the NHS or typical Western medicine was really great at treating cancer, but not so great at the kind of wraparound supportive care that would help her to feel well. And we've got like a lovely quote that we often use, where one of our users said that the NHS sort of saved my life, but Penny Brohn showed me how to live it. And I think that's like a really nice, a really nice way to showcase kind of what we do there. And we are a small but mighty team there. But I'm the physical activity lead, but we've got a nutritional lead, who's our lovely Kim. We've got a clinical lead now, who's the lovely Claire, who has worked in as a specialist cancer nurse. And a lot of us have all got kind of like hybrid roles. We've maybe got sort of our clinical experience and then we trained in another area. And we provide in-person services as well as online services. Online services definitely came a lot more after the pandemic. And they've been a real lifeline for a lot of people to access stuff when they can't, get out and about, or they've got the risk of infections high at that point in their lives. And we provide this toolbox of online sessions, so things like exercise classes. So I do a live one called Strength and Stamina. We've also got yoga instructors from physios to Tai Chi and Qigong, and then as well as like mindfulness practices or clinical hypnotherapy or like breath work as well. So like breathing for anxiety is like a really popular class as well. And then nutrition as well. So like nutrition know-how and just kind of like helping people with the basics, I think is probably our good is a good standpoint for us as a charity, because I think it can be really overwhelming. There's lots of noise in the cancer sphere online, and I think it can feel really overwhelming for a lot of people. And I think for a lot of people, they want to throw the kitchen sink at cancer, which I completely get. But I think we have a really nice toolbox that just helps people understand the basics, understands what's going on for them. And we have these kind of standalone sessions that people can dip in and out, whatever they want to do. We do in-person services where we've got these relax and restore retreats, which are just really just restorative, mainly for people who just need a bit of time out from cancer as such, and just, recover, recuperate, and it's really slow, really nice. And then we've got our kind of well-being. These we call our well-being days, but they're now kind of like our cancer support days. So we've got some upcoming ones that are focused primarily on things like fatigue, sort of managing anxiety, so mind matters, and then managing menopausal symptoms as well. So we get practitioners and doctors in as well. We recently did one with Danny Binghamton through menopause and cancer, which was an amazing day as well. So just thinking about the symptoms, I think that people are really struggling with, and I think that really helps to people to understand what the different pillars within that symptom that we can support with. And I think as a charity, we are starting to be more recognised as this kind of just a good package really in terms of supporting people through their treatment alongside that. And we've now been running another service called Treatment Support Programme for a number of years now, and that's been really popular and really helpful, looking at physical activity, nutrition, complementary therapies, and sort of supporting mental health and anxiety. And that's, again, focusing on those symptoms during treatment. And then my main job within my 15 hours a week at Penny Brohn at the moment has been setting up Prehabilitation. But because we are a cancer charity, we aren't a clinical service as such. So we kind of renamed it Preparing for Treatment Programme as opposed to Prehabilitation, which I would say was kind of more in the scope of the hospitals. And that is really us trying to help people navigate that time, which is very overwhelming for a lot of people. Often the focus is just getting to appointments and dealing with what's happened. But we know that when people start early and can start to think about movement, optimizing their nutrition, as well as helping them to navigate the sort of the resilience that's required to get through treatment as well, mentally and physically, we can utilize a lot of the services that we already have running at Penny Brohn on a weekly basis. These aren't just things that happen every so often. We're running these on a weekly basis. They're really regular, and so we created some on-demand resources to support people with thinking about all the different hats that all of us in the team have, but just really focusing on the things that are important. So thinking about just some strength training either in a chair or standing, getting that done if that's important and is required for you. If you're already meeting, you're active and you can still maintain that, we just might need to give you a bit of guidance and reassurance that you're doing it fine, and that's okay. So you don't need to add more. But then if we highlight that you need a bit more support from a nutrition perspective, then we can either book you in with our with Kim, who can do like a one-to-one with certain people. But ultimately, if we screen that person and they need more than what we can do as a charity, then we can help navigate them back into the NHS to go, actually, you need to be seen by the dietetics team to really support you prior to your treatment. So we can basically optimise them as much as we possibly can, with a slightly lighter touch that I think a lot of prehabilitation programmes have done in the past. But because we are in this very much landscape of minimal funding, and there's not a huge amount of funding, and unfortunately a lot of prehabilitation programmes have stopped, and there are still lots running, But ultimately, we were trying to figure out a way that we could, with the capacity that we have as a charity, to be a bit more than a leaflet and a bit more than a web page, but support people with a bit more hand-holding. And so our pilot has just finished, and so we're just kind of collecting some feedback and putting it through our client voice again, and making sure that we can, there's definitely things we've learned from the pilot that we definitely want to change and do differently moving forward. But that's what pilots are for. But it's been really exciting to be able to create stuff like that. I think as a nurse and as an exercise specialist, I think it's just nice that it's the drum is being sort of beaten by other healthcare professionals as opposed to just physios. We've utilised physios within our team as well to do that. But it's definitely something I'm very proud of and really excited to develop further, and then hopefully as part of our pathway at Penny Brohn. And ultimately will help save the NHS lots of money and improve people's quality of life, which, if anyone's in commissioning, please email me.
I love the plug. Emily, how can people access these? Is it just for people in the area of Pill, or can anyone nationally access it?
Yeah, so we are actually a national charity. We are Bristol's best kept secret, but we are trying to improve that by being on amazing podcasts like this. So we are a national charity. So we support anyone in the UK with any type of cancer at any stage. We do stuff in person. So like I said, those kind of more longer stays, and we can stay overnight as well. So we have a residential element at place at the centre, so you can stay over. But a lot of the services that we provide that I've spoken about are online as well, so they can be accessed by people all over the UK. So my strength and stamina classes, people local, but then I've got people up in Scotland who access the services, and we've got an amazing client support team as well who are lush. They are like the glue that keeps us all together, and they're just a great team to speak to as your kind of first entry point. But if you feel a bit overwhelmed by any of our services, or it just feels a bit too much, we do have the lovely Steph too, who's our personal planner, so she can book in a slot with certain people if they're really struggling to navigate it, to maybe look at their kind of, I suppose, their main concerns really, and then thinking, what are the services that might do that. And I think that's important for all of us to, from a holistic lens. It's great having this holistic toolbox, but ultimately it's quite overwhelming, even for me, to think about all the different things that I could do as an individual to improve my health. And, we can look at all the different spheres, but ultimately we have to prioritise what is the most important. And ultimately, as individuals, we're only going to have capacity really to focus on maybe one or two of those things. And particularly when you're navigating cancer, that capacity gets even less. It's great to have the toolbox, but just remember that you don't have to use every single tool at the same time. It might be that you just have to focus on a couple to kind of sort of build what you need to for that moment in time, park the rest of it, and then think about that as well. So that's just a good tip for people who maybe go to the website and think, oh my god, there's just so much that I could do. But just remember what do you need it for right now? What could be supportive of your health right now? What do you need to learn more about to help you understand things? So that can be really helpful too.
Emily, we're nearly out of time. I just wanted to ask, what's your biggest success story with a patient, just for anyone listening?
A lady that I had who was really struggling with incontinence after her treatment and just trying to rebuild afterwards, and no one really mentioned about the menopause and wasn't really sure about that either, which I and I think she was a younger woman as well, and I think just being able to signpost back to help her navigate the conversation she'd be having with her team. But this was stopping her from being able to be active. Incontinence and all of those things are a real barrier to exercise that can really impact someone's self-confidence. It impacts incontinence affects so much of our lives. I think that's why I'm so passionate about pelvic health to a degree, because it's almost like the foundation to our bodies to a degree. Well, it is, matter of fact, but it was, she couldn't go out with her friends. She couldn't, she couldn't pick her kids up. It was getting to the point where it was really impacting her life. And just through having conversations with her oncologist and her GP, sort of supporting her pelvic health really helped to, because she was struggling with, things like vaginal dryness and things like that, which was really impacting her pelvic floor as well. And just by having those conversations, getting prescriptions to support that element of her health, then doing some exercise that was a good level for her, which then was able to fit in with her life with young children. And she was keen to get back to playing netball, which again requires a lot of jumping, which for someone who's leaking is like a big, I'm never going to be able to do that ever again. And I think, and I was like, right, I can't promise you anything, but we're going to give it a good go. And just purely from doing all the little conversations, like getting the prescriptions with the GP and then doing some gradual exercise, doing some pelvic floor muscle training, which again had been mentioned prior to her treatment, but wasn't a big focus because, breast cancer and everything else is sort of primarily focusing on the upper part of their body. But, when you have to go through hormone deprivation treatment, again, that will affect your pelvic floor. And again, a lot of the conversation's always on sexual health and sort of and not necessarily on continence. And I think screening should be a little bit better for incontinence issues for anyone going through, like you guys with pelvic radiation and everything else. But just from doing that and getting regular exercise, but even just once a week, was really helpful. And then just adding in some bouncing exercises over time. And eventually we got her to playing netball again, which was, just nice. Because I think, again, there's just so much I can't. And, I've had clients again who are just like, I don't think I can do that. And I'm like, yes, we can. We can definitely do something. And I think that's my overarching message is something is better than nothing. And obviously I know it is a huge privilege working with, having an exercise specialist to help you along the way. My dream would be that anyone that goes through any health condition has support, even if it's just a little bit of support with exercise, to just be a bit more positive and to know that there's lots of things that they can do. Even if you are, restricted to a mobility scooter, there are definitely things that can be done. Overarchingly, I just want to know that there is always something people can do. It's just finding what makes you tick, but also what you feel safe doing is important too. So that's probably lots of messages there in one go. Sorry.
Amazing. No, absolutely. And really highlights how having that support and motivation is critical for patients being able to kind of be autonomous in going, actually, I can do this and it's something I can do for myself and isn't cancer related. Yes, you might be doing it because of the side effects that you're experiencing, but isn't it great to do something for yourself that isn't just, focused around cancer and the cancer treatment? And what you said resonated with me because being in a wheelchair for a number of weeks now, I attempted to do some yoga in a wheelchair, and do you know what? It made me feel so much better just because I was moving, because I've been so sedentary. I was like, do you know what? It's great to just be able to do something and move my body. And you do realise how actually not doing what you usually do, the reversibility is immense. And, your muscles do start to go as soon as you stop doing your usual activity and movement. So really important. So, Emily, at the end of all our podcast episodes, we always ask for top tips. So do you have any top tips for the audience?
I would say is essentially do what you can. In terms of when you're feeling overwhelmed by what you should be doing, I feel like the word should just go out the window and just be sort of booted out. Because I think ultimately we first need to kind of look at what we're already doing. Because for a lot of us, we might already be doing quite a bit already. And that's ticking the box in terms of the minutes that we're doing each week, in terms of physical activity and movement that we're doing and just in our everyday lives. So just taking a good check of that before you start sort of feeling bad that you're not doing enough, if that makes sense. So, and then just start adding in things like walking if you're able to, or doing the gentle movements. So if you're someone who is limited in your mobility, particularly with when you're struggling with fatigue, is take notice of what movement provides you, how it makes you feel. Because when you notice how it makes you feel afterwards, that feeling is what's to anchor. Anchor yourself to that feeling, because that will help you to know what your body needs when you are feeling rubbish. And so, I'll often, like you did that nice bit of chair yoga, I just do just some joint mobilizations, literally I'm quite a methodical person. So I quite like just sort of doing my wrists, then going to my shoulders, and then getting a bit of rotation, getting down into my hips, down into my knees. And just doing that for a couple of minutes, I already just feel a little bit warmer, and I feel a little bit like I'm primed. I've primed my body. I've got all of my, I've lubricated. I've got my WD-40 in all my joints sort of working. That can in itself just lift that kind of cloud that can sometimes be a bit like heavy and dark over us sometimes in terms of facilitating movement. So doing a little bit of movement that seems like it seems pointless to some people when I do that, but just do it and just notice how it makes you feel, because it might then be a facilitator for more movement. So, and that's my biggest tip whenever I'm working with anyone, is like, if you're feeling super rubbish, don't think about the goal of getting like one big workout done. Like, take it back, like have the intention of going, right, my intention is to move today, but I'm just going to bring it back to, I'm just going to do what I can do right now. And if that then enables me to do more, ideal. If not, tomorrow's another day. So that's kind of, probably my biggest tip when it comes to movement and managing side effects, is just do a little bit, see how you feel, and then do more if you're able. If not, tomorrow's another day.
Amazing. A huge thank you to our guest Emily Spillman for talking about her role as a physical activity lead at Penny Brohn UK. Thank you for listening to Rad Chat with myself, Jo McNamara, and Julka-Anderson. Our next guest to feature will be Dr. Matt Morgan, as part of our Education and Workforce Development series about his role as a consultant in intensive care and his experience of witnessing near-death experiences. Thank you very much. Well, you can use this episode as part of our free continual professional development, accredited content, which offers flexible learning that fits your busy schedule. Just check out the show notes for the reflective questions, links to literature and resources, and link to the completed form to receive your accredited certificate.
Stay up to date with the latest radiotherapy and oncology advancements by liking and following us on social media and hitting subscribe wherever you get your podcasts.
Please do join our supportive community designed by professionals who understand the unique challenges of working within radiotherapy and oncology. Follow us across all of our social media channels, and make sure to check out our website www.radchat.co.uk. Together, we're actively working to improve our profession and make a lasting positive impact on cancer care.
It goes without saying that we can't achieve this alone. It takes all of us working together to create real change. That's why we value every voice and every contribution. We ask that you listen and learn and spread the word, share your story with us and connect with us.
And if you have liked this content, why not buy us a coffee? Go to our website and drop us some love. Thank you all for listening, and take care.